Pope Francis and the Silent Battle: How Pneumonia Threatens Millions of Elderly People. Have you ever wondered why a simple respiratory infection can take an elderly person to the hospital in a matter of days? What really happens in an older person's lungs when pneumonia strikes? And how is it possible that a treatable disease still kills more than 3 million elderly people a year worldwide? Recently, the world followed with apprehension the news about the health of Pope Francis, 87 years old, who had to cancel appointments due to pneumonia. This episode brought to light an alarming reality. Pneumonia is one of the most dangerous diseases for people over the age of 65, but it is still often underestimated. What many don't know is that identifying the early signs can make the difference between a full recovery and serious complications that can lead to death. Let's get started. The invisible killer. Understand what pneumonia really is and its attacks on the elderly. Pneumonia is not just a bad cold as many think. It is a serious infection that causes inflammation in the air sacs of the lungs, called alveoli. When these small sacs fill with fluid or pus, breathing becomes extremely difficult. For the elderly, this condition is particularly dangerous because their respiratory and immune systems are already naturally weakened by the aging process. What would be a mild infection for a young adult can quickly turn into life-threatening for someone over the age of 65. Pneumonia can be caused by bacteria, viruses, or fungi, with bacterial pneumonia being the most common and severe form in the elderly. Streptococcus pneumoniae, known as pneumococcus, is responsible for most severe cases that require hospitalization. Recent studies by the World Health Organization show that pneumonia is the leading cause of death from infection in older people worldwide, surpassing other common respiratory conditions. The risk of death from pneumonia increases significantly every decade after the age of 65, reaching alarming rates after the age of 80. Surprisingly, many cases start with mild symptoms that can easily be mistaken for other, less serious conditions, such as colds or seasonal allergies. But what really happens when these early signs are ignored? What few know is that in just 72 hours, untreated pneumonia can evolve from mild symptoms to a severe condition requiring hospitalization. Life-saving signs. Recognize the symptoms of pneumonia before it's too late. Identifying pneumonia in the elderly is a real challenge, even for experienced doctors. Why? Because the classic symptoms that appear in young adults are often absent or manifest atypically in older people. This insidious characteristic of the disease causes many cases to be diagnosed late, when the treatment is already more complex and less effective. Knowing the specific symptoms in the elderly can literally save lives. Let's examine each warning sign you need to be aware of, especially if you care for someone of advanced age. 1. The treacherous cough. When this common symptom becomes a warning sign. Cough in pneumonia is not like any other cough. It is persistent, lasting more than 2 or 3 days, and often worsens rather than improves over time. In the elderly, this cough may initially be dry, with no mucus production, which often leads to mistaking it for heart problems or medication side effects. After a few days, it can develop into a productive cough with yellowish-greenish phlegm, or even traces of blood. What makes this symptom particularly dangerous in the elderly is that some older people are unable to cough hard enough to expel the secretions. This can lead to the accumulation of fluid in the lungs, quickly aggravating the infectious condition. Research from the American Geriatric Society indicates that approximately 60% of older adults with pneumonia have cough as an initial symptom, but only 30% of them recognize this as a potential warning sign. The key is to watch for changes in the cough pattern, especially when it persists for more than 3 days or comes on suddenly without other cold symptoms. Another important characteristic is that pneumonia cough usually does not improve with common cough medicines, unlike coughs caused by allergies or simple colds. If your elderly family member has developed a persistent cough, especially after a cold or flu, don't wait to seek medical evaluation. This simple decision can make all the difference in the prognosis of the disease. How do you differentiate a normal cough from a cough that may indicate pneumonia? Keep an eye out for the next symptom that often accompanies this condition and forms a dangerous combination. 2. Fever and chills, the thermometer that can save your life. Fever is one of the most important defense mechanisms of the human body against infections. In young adults with pneumonia, temperatures above 38 degrees are common and easily recognizable. In the elderly, however, this defense mechanism often does not work as it should. Instead of a high fever, many have only a slight increase in body temperature, sometimes as subtle as half a degree above normal. Even more surprising is that approximately 30% of older adults with severe pneumonia have no fever at all, according to research published in the Journal of the American Geriatric Society. In some cases, the opposite may occur. Hypothermia, that is, body temperature below normal. Chills, on the other hand, are more reliable signs of the presence of infection, even when fever is not detected. Involuntary shivering, feeling intensely cold even in hot environments, or needing multiple blankets can indicate that the body is fighting a serious infection, even without apparent fever. The absence of high fever in older adults with pneumonia is one of the main reasons for late diagnoses and avoidable complications. Therefore, geriatricians recommend that any change in body temperature in people over 70 years of age be investigated, especially if accompanied by respiratory symptoms. A practical tip is to keep a thermometer at home and check the temperature twice a day if infection is suspected, even if the person does not feel feverish. Small variations in basal temperature may be the only indication that something is wrong. And what happens when the infection spreads through the lungs? The next symptom is one of the most alarming and requires immediate attention. 3. Compromised breathing. When every breath becomes a battle. Difficulty breathing, or dyspnea, is one of the most severe symptoms of pneumonia, and usually indicates that the infection has already affected a significant portion of the lungs. In the elderly, this symptom can appear suddenly or gradually, evolving over several days. In its early stage, it can manifest itself only during physical activities that were previously performed effortlessly, such as climbing a flight of stairs or walking around the house. As the infection progresses, difficulty breathing may occur even at rest, an alarm signal that requires immediate medical attention. A particular characteristic of pneumonia in the elderly is rapid and shallow breathing, with more than 20 breaths per minute, technically known as tachypnea. This is often the first vital sign to change, even before the appearance of other more obvious symptoms. Mayo Clinic studies show that blood oxygen saturation drops significantly in older adults with pneumonia, even when other symptoms appear mild. The use of a pulse oximeter, a device that measures blood oxygenation, can detect problems even before the difficulty in breathing becomes noticeable. Another important aspect is that many elderly people do not spontaneously report the sensation of shortness of breath, adapting to the difficulty breathing by gradually reducing their daily activities. Family members and caregivers should be aware of changes in functional capacity or willingness to perform daily tasks. Impaired breathing in pneumonia is often accompanied by another symptom that can be easily confused with heart problems, and it is precisely this symptom that we are going to talk about now. 4. The telltale pain. Why chest discomfort should never be ignored. Chest pain in pneumonia has specific characteristics that differentiate it from cardiac pain. It usually worsens during deep breathing or coughing, a phenomenon known as pleuritic pain. In the elderly, this pain may not be as intense as in younger patients, manifesting as a vague discomfort or pressure in the chest that is often mistakenly attributed to muscular, digestive, or heart problems. It is this ambiguity that makes the chest pain of pneumonia particularly dangerous in the elderly population. The location of the pain can give clues as to which part of the lung is affected by the infection. Pain in the right side of the chest often indicates pneumonia in the lower lobe of the right lung, while pain in the left side may suggest involvement of the left lung. Data from the American Lung Association show that approximately 45% of older adults with pneumonia report some type of chest discomfort, but less than half of these cases are initially associated with lung infections. The delay in diagnosis caused by this confusion can result in serious complications that could be avoided with early intervention. An important note: any new chest discomfort in older people especially those with a history of breathing problems, should be evaluated by a doctor, even if it seems mild or transient. The differentiation between cardiac and pulmonary pain requires clinical evaluation and, frequently, complementary tests. When the infection progresses and affects a larger area of the lungs, other organs, including the brain, may begin to suffer from a lack of adequate oxygenation. This brings us to the next symptom, which is often the most overlooked in elderly patients. 5. Mind in danger. How pneumonia affects the brain without you realizing it. One of the most underestimated and, at the same time, most dangerous symptoms of pneumonia in the elderly is the alteration of mental status. This change can range from mild confusion to severe disorientation or delirium. Surprisingly, in up to 40% of older adults with pneumonia, brain fog may be the first and only overt symptom of the disease, according to a study published in the New England Journal of Medicine. Often, there is no fever, cough, or other classic signs of lung infection. This phenomenon occurs because the brain is extremely sensitive to small reductions in blood oxygen levels, which happen when the lungs are compromised by infection. In addition, the body's inflammatory response to pneumonia can directly affect brain function. Family members may notice subtle changes such as difficulty finding words, more pronounced recent memory loss than usual, alteration in the sleep cycle, or unusual behavior. These cognitive changes can appear days before more obvious respiratory symptoms, functioning as an early warning that is rarely recognized as part of a lung infection. Healthcare professionals trained in geriatrics know that any acute change in an older person's behavior or cognition should be considered a warning sign for possible infections, with pneumonia being one of the main suspects. For older adults with pre-existing dementia, the diagnostic challenge is even greater, as the cognitive changes caused by pneumonia can be mistakenly attributed to the natural progression of the neurodegenerative disease. In these cases, careful medical evaluation is essential. And when the lung infection robs the body of its strength, the next symptom may seem common, but it has specific characteristics when associated with pneumonia. 6. Mysterious exhaustion. When tiredness hides a lung threat. Fatigue in pneumonia is not the common tiredness of everyday life. It is a deep exhaustion, disproportionately intense in relation to the activities performed, and which does not improve with rest. In the elderly, this symptom may be the first sign of the disease, appearing days before the most typical respiratory symptoms. It is a fatigue that significantly impacts functional capacity, making even basic activities such as bathing or preparing meals difficult. Why does this happen? When the lungs are compromised by infection, the body receives less oxygen while simultaneously consuming more energy fighting infection, creating a significant energy deficit. Research from the U.S. Centers for Disease Control and Prevention indicates that more than 80% of older adults with pneumonia report extreme fatigue, but only a third of them associate this symptom with a respiratory problem. Fatigue is often attributed to natural aging, sleep problems, or medication side effects, delaying the correct diagnosis. An important warning sign is the relatively rapid onset of this fatigue, in a matter of days, in contrast to the gradual tiredness associated with chronic conditions or the aging process itself. Family members should be aware when a previously active elderly person suddenly starts taking long naps or gives up usual activities. This extreme exhaustion is usually accompanied by another symptom that, although it seems less serious, can have serious consequences for the health of the elderly, especially the most fragile. 7. The appetite alert. How food refusal can signal severe pneumonia. Loss of appetite is a frequent symptom in infections, but in pneumonia in the elderly, it takes on worrying characteristics. It's not just a temporary reduction in interest in food, but a persistent aversion to food that can quickly lead to malnutrition. In older people, whose nutritional reserves are already naturally reduced, even a few days of inadequate caloric intake can result in significant loss of muscle mass and impaired immune response. This vicious cycle further weakens the body's ability to fight off lung infection. The decrease in fluid intake that usually accompanies loss of appetite can lead to dehydration, aggravating the clinical condition and making lung secretions thicker and more difficult to eliminate through coughing. Swallowing problems, which are more common in the elderly, can intensify during pneumonia due to rapid breathing and generalized weakness. Studies by the National Institute on Aging demonstrate that unintentional weight loss greater than 5% in 1 month is an independent predictor of poor prognosis in older adults with pneumonia. Persistent food refusal in an older person, especially when associated with other subtle symptoms, should be considered an alarm signal for possible serious infections, including pneumonia. One strategy recommended by dietitians specializing in geriatrics is to regularly monitor the weight and appetite of older adults, especially during the colder months when respiratory infections are more common. Small changes can be detected early, allowing interventions before the condition worsens. But why are the elderly so much more vulnerable to this disease that seems simple to treat? The answer involves multiple factors that we will explore below. Fatal vulnerability. Why your aging opens the door to pneumonia. Aging causes fundamental changes in the respiratory system that dramatically increase the risk of pneumonia. Lung capacity naturally decreases with age, reducing the effectiveness of gas exchange. The respiratory muscles, including the diaphragm, progressively lose strength after the age of 65, making it difficult to breathe deeply and cough effectively. This reduction in the ability to eliminate secretions creates an ideal environment for the proliferation of microorganisms in the lungs. In addition, the immune system undergoes a process known as immunosenescence, characterized by decreased antibody production and cellular immune response. This change makes the elderly more susceptible to infections and reduces the effectiveness of vaccines. Studies by the American Lung Foundation show that airway protection mechanisms also change with age. Ciliary movement, which is responsible for removing inhaled particles and microorganisms, becomes less efficient, allowing more pathogens to reach the lower portions of the lungs. Common chronic conditions in the elderly, such as diabetes, heart failure, and chronic obstructive pulmonary disease, multiply the risk of developing severe pneumonia. The presence of 2 or more of these conditions increases the likelihood of hospitalization for pneumonia by up to 6 times. The use of certain medications, particularly sedatives, opioid analgesics, and some psychotropic drugs, can depress the cough reflex and increase the risk of aspiration when small amounts of food or secretions are inhaled into the lungs. The resulting aspiration pneumonia is especially dangerous and common in older people with swallowing difficulties. This scenario of increased vulnerability is precisely what has made Pope Francis's condition so worrying for doctors and faithful around the world. Let's better understand what happened to the Catholic leader and the lessons we can draw from this case. The Pope and pneumonia. Lessons from Francis's fight that could save his life. When the Vatican announced that Pope Francis, at the age of 87, was facing pneumonia, the concern was immediate. The pontiff, who had already lost part of a lung to an infection in his youth, faced an even greater risk. The Pope's doctors implemented an aggressive treatment protocol, including intravenous antibiotics and constant monitoring of oxygen levels. This proactive approach, even with initially mild symptoms, perfectly exemplifies the principle that in the elderly, pneumonia must be treated urgently before it becomes severe. Francis has publicly demonstrated the importance of strictly following medical recommendations, canceling appointments to focus on full recovery. This decision conveyed a powerful message about the need to prioritize health, especially in older age. A less commented, but equally relevant aspect of the case was the role of prior vaccination. The Pope had received the pneumococcal vaccine, which probably contributed to a less severe course of the disease, demonstrating the importance of immunization for the elderly, even those in apparently stable health. The Vatican's transparency in communicating about the pontiff's condition also offers an important lesson. Early diagnosis and proper treatment of pneumonia are not causes for unnecessary alarm, but rather responsible actions that can prevent serious complications. Pope Francis's recovery, while gradual, has shown that even elderly individuals in compromised health can overcome pneumonia when they receive appropriate care at the right time. This message of hope is particularly important for family members of elderly people diagnosed with the disease. But what are the tools that modern medicine offers to combat this threat to our elderly? let's explore the treatment options currently available. Arsenal against the disease. Modern treatments that are beating pneumonia. The treatment of pneumonia in the elderly has evolved significantly in recent decades, with personalized approaches that consider the peculiarities of this age group. The choice of treatment depends on the causative agent, the severity of the symptoms, and the patient's pre-existing conditions. For bacterial pneumonia, antibiotics remain the mainstay of treatment, but the selection of the optimal drug has become more judicious. Recent studies by the American Society for Infectious Diseases show that some antibiotic combinations are particularly effective in the elderly, with a lower risk of serious side effects. Viral pneumonias, such as those caused by the influenza virus or SARS-CoV-2, can benefit from specific antivirals when diagnosed early. Initiation of treatment within the first 48 hours after the onset of symptoms is associated with better clinical outcomes. Supportive therapy, including adequate oxygen therapy, hydration, and fever control, plays a key role in the recovery of the elderly. The use of home oxygen therapy under medical supervision has allowed many elderly patients to be treated at home, reducing the risk of hospital-acquired infections and other complicating factors. Advances in respiratory physiotherapy have contributed significantly to improving the elimination of secretions and accelerating the recovery of pulmonary function. Non-invasive breathing aid techniques, such as non-invasive positive pressure ventilation, can prevent the need for intubation in more severe cases. For patients with aspiration pneumonia, which is increasingly common among the elderly, specific protocols that combine broad-spectrum antibiotics with measures to improve swallowing have shown promising results. Early speech-language pathology evaluation is now an integral part of the treatment of these cases. Even with all these therapeutic advances, prevention remains the most effective strategy against pneumonia in the elderly. And it is precisely about preventive measures that we are going to talk about now. Protective shield. Proven strategies to prevent pneumonia from finding you. Prevention of pneumonia in the elderly involves multiple strategies that, when combined, dramatically reduce the risk of severe infection. Vaccination leads these strategies, with two main vaccines recommended for people over 65 years of age. The 300-valent pneumococcal conjugate vaccine protects against the 13 most common strains of pneumococcus, which are responsible for most severe bacterial pneumonias. A single dose is usually sufficient, with boosters recommended only in specific situations. The influenza vaccine, updated annually to combat circulating strains of the virus, is equally important, as influenza often precedes or predisposes to secondary bacterial pneumonia. Studies from the Center for Disease Control show that influenza vaccination reduces hospitalizations for pneumonia by up to 60% during flu season. In addition to vaccines, respiratory hygiene measures play a crucial role. Frequent hand washing, wearing masks in environments with high circulation of people during periods of respiratory surges, and avoiding close contact with sick people are life-saving practices, especially among the most vulnerable. Proper nutrition strengthens the immune system and natural defenses against infection. A diet rich in protein, vitamin C and D, and zinc has been linked to lower incidence of pneumonia and faster recovery when infection occurs. Regular breathing exercises, such as deep breathing and simple lung expansion techniques, help keep the lungs healthy and improve the ability to eliminate secretions. Structured pulmonary rehabilitation programs can benefit older adults with a history of respiratory problems. Proper management of chronic conditions such as diabetes, heart failure, and lung disease significantly reduces the risk of developing severe pneumonia. Adherence to prescribed treatments and regular monitoring of these conditions are essential for prevention. Despite all these preventive measures, it is essential to know how to recognize when pneumonia requires immediate medical attention. The next signs can make the difference between life and death. Emergency alarm. When rushing to the hospital can make a difference. There are warning signs that indicate that pneumonia in an elderly person has evolved to a critical condition that requires immediate medical intervention. Recognizing these signs can literally save lives. Severe respiratory distress, characterized by breathing too fast, more than 30 breaths per minute, or inability to complete sentences without stopping to breathe is a medical emergency. This indicates that the lungs are not able to supply enough oxygen to the body. Bluish discoloration of the lips, nails, or skin, known as cyanosis, is an extremely worrying sign of inadequate oxygenation. This symptom should never be ignored and requires immediate emergency care. New or worsening mental confusion, disorientation, or excessive sleepiness may indicate that the brain is not getting enough oxygen due to severe pneumonia. Abrupt changes in state of consciousness in older people with suspected respiratory infection should be treated as emergencies, even in the absence of other severe symptoms. Persistent fever above 39 degrees that does not respond to antipyretic medications, or hypothermia, temperature below 35 degrees, are signs that the body is losing the ability to regulate its temperature in the face of severe infection. Significantly low blood pressure, usually accompanied by dizziness when standing up or pulsing too quickly, may indicate that the infection is impacting blood circulation, a precursor to septic shock. Research from Johns Hopkins Hospital shows that medical intervention in the first 4 hours after the appearance of these alarm signs is associated with a reduction of almost 40% in mortality from severe pneumonia in the elderly. This is a powerful reminder that when it comes to pneumonia in older people, it's always best to err on the side of caution. As family members and caregivers, it is our responsibility to be aware of these signs and act promptly when necessary, without hesitation or unnecessary delay. A trip to the emergency room that turns out to be just a scare is infinitely preferable to a wait that results in avoidable complications. It's time for one last thought on how we can turn knowledge into action to protect our loved ones. It is possible to win the battle against pneumonia in the elderly. Pneumonia in the elderly no longer needs to be the silent killer it has been for so many decades. With the knowledge we share today, this disease can be prevented, identified early, and successfully treated. Just as Pope Francis managed to overcome his pneumonia and gradually return to his activities, thousands of elderly people can have the same opportunity when surrounded by informed people who are attentive to the first signs of the disease. The power to save lives is literally in your hands right now. Every symptom you've learned to recognize, every preventative strategy you implement, can make the difference between life and death for a loved one. Do not wait for pneumonia to manifest itself in its most severe form to act. Early diagnosis is the key to successful treatment and a full recovery, especially in people over the age of 65. The best way to honor our seniors is to protect them with the shield of knowledge and continuous attention to their health needs. Share this information with family and friends who care for older people. Talk to your doctor about recommended vaccines and prevention strategies tailored to your specific situation. Remember, pneumonia in the elderly is a serious condition, but not invincible when faced with knowledge, vigilance, and quick action. Wisdom lies in recognizing the subtle signs before they turn into a devastating storm in the lungs. Now it's your turn to use this knowledge to protect those who need it most. Every elderly person deserves to age with dignity and health, free from the invisible threats that pneumonia represents. Life is too precious to be compromised by a disease that we can prevent and treat.